Hi everyone, I'm Jeff from the Office of Safety, Health and Environment and the Saw Street Hall School of Public Health. Welcome to the NUS COVID-19 Return to Work training. If you are coming back to campus to work following the circuit breaker period, you are required to follow the procedures and practices highlighted in this video. This to ensure the safety of everyone on campus. COVID-19 is an infectious disease caused by a newly discovered coronavirus. This new strain of coronavirus was identified at the end of 2019 and has resulted in cases of severe lung infections globally. To date, about 5 million people in over 150 countries were infected, with over 300,000 deaths. The disease affects people of all ages and demographics. Most patients exhibit mild symptoms and recover quickly, but a small percentage of patients become seriously ill and die. There are no known cures for the disease. There are also reports of undetected cases in which patients do not exhibit symptoms but are still infectious. Now, let's take a look at some of the important symptoms of COVID-19 to look out for. The two most common symptoms are fever and a dry cough. A sore throat may also develop. A person infected with the virus may experience tiredness or an overall lack of energy, causing him to feel drained, weak, or sluggish. He might also experience muscle aches and breathlessness, as well as a loss of taste or smell. Other symptoms may also include diarrhea, nausea, frequent headaches, and rashes. COVID-19 can spread through various modes, such as through droplets generated during coughing or sneezing, during close contact with another individual, or when touching a contaminated object or surface before touching your face, mouth, nose, or eyes without washing your hands.
Hi, I'm Pek Tian Guan from the Office of Safety, Health and Environment, and I'll be guiding you through the measures and practices you should adopt to prevent the spread of COVID-19. Washing your hands frequently is one of the most effective ways to prevent the spread of the virus. You may use a hand sanitizer if hand washing facilities are not available. Avoid physical contact with others to reduce the spread of the virus. It is important to keep your workspace clean. This includes common spaces and equipment such as phones, desk surfaces, computer equipment, shared laboratory equipment, and door handles. For shared workspaces, for example, a hot desk, give it a wipe down before and after occupying it. Symptoms and temperature declaration is one of our control measures to keep the NUS community safe. Take note of any symptoms that you might experience and take your temperature twice daily. Remember to declare your symptoms and temperature in the NUS portal shown here. If you display COVID-19 symptoms at work and is not due to any pre-existing conditions, please inform your reporting manager immediately and consult a doctor. See the same doctor if your symptoms return or persist after consultation. Do not Dr. Hop. Reduce physical interaction as much as possible by telecommuting and holding virtual instead of physical meetings. If critical physical meetings are required, limit the number of attendees and shorten the meeting duration. If work must be performed on campus, stagger your working hours and meal times and avoid coming to campus during peak hours. Implement split team arrangements. There should not be any cross-deployment or interaction between employees in different teams. For example, members of the blue team and members of the orange team should not be in the same meeting room at the same time. Activities with close or prolonged contact should be avoided, even among members of the same team. To minimize physical interaction, the university is divided into zones. You should stay within your allocated zone. Scheduled deliveries by vendors should be staggered to avoid crowding of loading and unloading bays. Safe distancing must be observed in all areas. For example, in lifts, in meeting rooms, bus stops, internal shuttle buses, food courts, and canteens. Wear a mask when you're on campus at all times, including in laboratories and offices. This is in addition to other personal protective equipment, or PPEs, required for your activities as identified in your risk assessment. Should the wearing of masks or certain mask types be unsuitable for your activity, substitute with appropriate alternatives as determined in your risk assessment. The mask should cover your mouth, nose, and chin. To remove a used mask, hold the mask only by the earlobes. Access to workplaces must be limited to essential staff and authorized visitors only. Safe Entry is a digital check-in system which logs employees and visitors' entry into your workplace. All staff, visitors, and contractors are to use Safe Entry to facilitate contact tracing. In addition, all visitors must use the visitor registration system and observe safe distancing measures. They must also undergo temperature screening, and visitors who are unwell must be refused entry into the workplace. Use the Trace Together mobile app to facilitate contact tracing. If you're not feeling well, you should seek medical attention immediately. If a person is unable to seek medical attention on his own, the person should be guided to an isolation area or room, and his colleague should call 995 or campus security at 6874-1616 for an ambulance. To prevent the importation of COVID-19, all staff and students are required to declare their overseas travel plans using the Overseas Travel Declaration. Do remember to update your travel declaration if your travel plans have changed. As we fight the battle against COVID-19, it is important that everyone observe these procedures and practices to reduce the spread of the virus. Do your part. Keep everyone safe.